A new brain implant that uses ultrasound to potentially boost people's moods is going under trial at the NHS. This is a fascinating device that's designed to help patients with conditions such as depression, addiction, OCD, epilepsy, and maybe even more. And the basics of it is that it works kind of like TMS. If you're familiar with TMS, that's transcranial magnetic stimulation, a non-invasive brain stimulation that uses magnetic pulses to treat depression and obsessive compulsive disorder. This does a very similar thing. So this one uses magnets. However, the new thing that we're talking about today uses ultrasound. The device is designed to be implanted beneath the skull, but outside the brain. So right there, kind of in that in-between layer. It maps activity and delivers targeted pulses of ultrasound to switch on clusters of neurons. Its safety and tolerability will be tested in 30 patients in a roughly 6.5 euro trial. I'm going to scroll down here to where they talk about how this works just a little bit, if I can find the right one. Yes, they can actually test the device without needing to perform surgery, which is extremely useful. But if it works for you, they can perform the surgery. They put it under the skull, but not in the brain. And once it detects that some neurons aren't firing perhaps the way they should, this implant can deliver focused ultrasound to mechanically nudge neurons toward firing, providing a way to remotely dial up activity at precise locations in your brain. So when you read these stories online, like scientists were shocked when blah, blah, blah brain region lit up when the patient was experiencing anxiety, or patients with depression have lower levels of activity in this tiny little region in their brain. Well, what this implant will do is target that very specific region for your condition and give it a little ultrasound nudge and try to get it to activate. Just get the neurons to do something and see if just keeping them active will actually help people with depression, addiction, and OCD. And I really hope this is the case. I think it's a very cool piece of technology. I love that it's minimally invasive, might be the correct word here, and I hope it helps a lot of people.